Hi, welcome to this unique haircare initiative by IPCA. I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory; it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle age problem when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in the daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years people complaining about hair problems. Most of these problems, if identified early, can be manageable and much of the hair loss can be avoided. Today, we have with us Dr. Dr. B. Soorya is a well-known dermatologist and has been practicing medicine for over many years now. She's MBBS and specializes in dermatology, cosmetology, and trichology. Currently, she's practicing at Skin Pro, Erode, Tamil Nadu. Dr. Soorya has dedicated her career to diagnosing and treating a wide range of skin and hair conditions by providing personalized hair care services to her patients. She takes time to listen to patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Doctor is also aware of the need for the patient education and awareness about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you so much, Doctor, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to this YouTube live show.
Thank you for having me. Thank you. It's my pleasure.
Dr. Hamasa Junnikle Bahut bahut Shukriya. So today we are going to talk about hair care in current scenario. So whenever we talk about hair care in current scenario, the very common problem which is faced by all of us, like irrespective of gender and age, is hair loss. So can you please enlighten us today with your profound experience, like what is this hair fall and when to be concerned for what's normal and what's not normal?
Hair fall is a major concern for all age group nowadays because of our lifestyles and everything else. Not every hair fall is abnormal. When you have a hair loss, about 50 to 100 strands of hair per day is normal, and hair grows in cycle. So some hair is shedding, and while others are growing. So when should we concern? When you have more than 100 hair loss per day, or when there is thinning or baldness, or when there is pattern hair loss. For women, it will be widening of the parting area, which we usually do, will be abnormal. And if you have a patchy hair loss, which we call as alopecia areata, is abnormal. When you have your scalp is itchy, inflamed because of your seborrheic dermatitis or dandruff, that is abnormal. And you have excessive shedding of hair due to hormonal or nutritional deficiency, then that is also a problem. So you please consult your dermatologist when there is more than 100 hairs lost per day and get a correct diagnosis and treatment for it.
Okay, doctor. So, doctor, like whenever we talk about this hair fall, hair loss, the very the treatment called hair transplant is very prominent. So, what is this hair transplant? And can you please like enlighten us, like how do we proceed to hair transplant? Is there any stages of treatment or something like that?
Yeah, hair transplant is a surgical procedure where they move the hair follicle from one part of your body, where it's usually behind your scalp, the area back of your scalp or side, to the area where there is baldness or thinning of scalp. It can be done by many techniques depending upon the expert who is doing it. And the candidates for hair transplant, I would say, is when you have a progressive or pattern hair loss. When your hair loss is very progressive and consistent, when there is failed medical treatment for hair loss by a qualified dermatologist or hair transplant surgeon, and when there is disfigurement or genetic history, then you are a good candidate for hair loss, hair transplant surgeon. Sorry.
Okay. Okay, and can you please enlighten, like what is this hair transplant? Do they put our hair on our head?
No, it's a surgical procedure. It's normally done under local anesthesia, so you will be aware what they are doing. So
Okay.
there won't be any problem. They take a simple hair follicles, each small hair follicle from the area, donor area, which will be behind your scalp, to the area where there is baldness or thinning. They take the follicle and put it in that area through a small hole. That is called a hair transplant surgery. Nothing big. It's a minimally invasive surgery, but it needs a qualified person to do it.
Oh, okay. That's a very interesting, doctor. So, doctor, like when to refer the trichologist for hair transplant? Like, is there any preferred time? Like someone is facing like there is a hair fall and then go to the trichology. Like, when do people like what are those alarm signs?
I'd say go as early as possible. When you consult your dermatologist, start with medical treatment early. When there is a failure of medical treatment, in addition, you need a hair transplant, then they will advise you whether you are a good candidate or not. But I'll advise you to, if you have a strong genetic history, if there is thinning or pattern hair loss starting for you, it's better to start early because as early the hair transplant is done, there will be better outcome will be there for you.
Okay, interesting, doctor. So, doctor, it's kind of a surgical process, so people are like scared about it. So, is hair transplant safe? Is there any complications after hair transplant?
It is a very, very safe procedure. It's a minimally invasive procedure, so nothing to be afraid of. But there may be mild and temporary complications like some discomfort, like scalp tightness, swelling of your scalp or around your eyes after the procedure, scabbing, crusting, which is all temporary and it can be easily managed by the hair transplant surgeon. So, no major complication if you get it done by a qualified and trained hair transplant surgeon.
Okay. So, like doctor, you said that we do anesthesia and then we do the surgical process. But does this procedure hurt like before and after, or is any time in future?
I don't get it. Can you repeat the question, please?
Like, does this hair transplant procedure hurt?
No, it doesn't hurt. Maybe the injection given for your local anesthesia, it's very, very small syringe is used to give you the injection. At that time, there will be small prick. After that, you won't feel any pain during the procedure. But since you're lying upside down for 4 to 6 hours for the whole procedure, there may be discomfort in your body. But as such, there won't be any pain for your procedure.
Okay. Okay, that's interesting, doctor. So, it's okay to go for a hair transplant. You don't need to be scared, and there is always like pre-post care given by the doctor.
Yeah, see, if it's done by a qualified dermatologist and if you need the hair transplant, please go with medical treatment first. And then, if your need is there, then go for hair transplant. It's one of the safest procedure done day to day. So, no need to be afraid about pain, complication if it is done by a qualified dermatologist. But even after hair transplant surgery, you have to continue a minoxidil and nutritional supplement for maintaining your hair.
Okay, interesting, doctor. So, doctor, in this era of information, even like while traveling, you see in the poster in 1,000 rupees, you will get all your hair back. So, what is what is the cost of hair transplant in India?
See, it depends upon several factors, depending upon the surgeon, city where you're doing. Main factor is how many number of grafts you are needed. It depends. Some may need 800 grafts, some may need 2,000, 2,500. It can be done in different sessions also. A larger number of grafts cannot be done in same sessions. So they divide the session also. It can go up to a lakh or more, not more than that, depending upon number of grafts needed for you. So don't go for a clinic which offer like very, very cheap prices because you need a qualified person for better outcome.
Okay. So, doctor, like when we are talking about this cost and cheap, so how do people choose the clinic for hair transplant? What they should look for before choosing the clinic to visit?
The first thing is there should be a qualified and trained hair transplant surgeon who will be a dermatologist or a plastic surgeon. No other departments are enriched to do this procedure. And then the do not go to clinic which, as I said earlier, which offer very, very low price or which promises 100% result or permanent cure like that. And also there won't be any permanent cure or 100% result in this procedure or any other procedure depending upon your hair, concerning your hair. And also make sure that clinic has a qualified person to do your procedure.
Okay. So, doctor, now that we know how to choose the clinic and the other stuff, like it doesn't hurt. Like one of another very common questions, like people who have been looking thinking for doing hair transplant surgery, they think like, is there any care to be taken after hair transplant? Like, can you please enlighten, like, what care to be taken after hair transplant by the patient to maintain their hair?
Yeah, it is very, very important. Aftercare is very, very important, not only for the graft survival or scalp healing, it also important for your long-term results. So there will be lot of do's and don'ts which will be given by your surgeon after the procedure. But I'll say the major factors which are the do's and don'ts. That like after procedure, sleep with a pillow like 45-degree angle, so there will be reduction of swelling. Do not rub, scratch, or touch your scalp graft transplant, and use saline spray to keep the which will be prescribed by your surgeon to keep the graft moist, and wash your hair according to the advice given by your surgeon and with a mild shampoo which they will advise you, and please take the anti-inflammatory drugs or antibiotic or painkillers suggested by your surgeon, and do not exercise, do a heavy exercise for 10 to 14 days after the procedure. Do not wear tight caps because the procedure it will be shown outside that they have done a procedure. Don't wear a tight caps. Do not use harsh chemicals. There'll be mild scabbings and crusting will be there in the area which we have done the transplant. It will take some days, 7 to 10 days to fall. Everything will be normal, and there will be hair loss 2 to 3 weeks. Even the follicle which we have planted after the surgery, so, but your hair will grow afterwards, so no need to worry. Follow whatever your surgeon has said and be vigilant because it's a very, very delicate procedure. Take care of your scalp and hair.
Well, that's very informative, doctor. Through this platform, can you please let us know? Like, there are so many doctors. Like, there are MBBS, there are physician, and there are dermatologists. So, like, whom to visit for any hair transplant surgical processes? Like, what certification one should look for before visiting to the doctor?
See, as a dermatologist, we first do MBBS, then MD DVL, which is dermatology, venereology, and leprology. Consult a dermatologist who is trained in hair transplant surgery or a plastic surgeon who does MBBS, MS, and then MCH in plastic surgery. They who are trained in hair transplant surgery. These are the two divisions who are qualified to do hair transplant surgery, not any other divisions.
Okay, so no, not saloon or any other. You have to see the
No,
proper.
absolutely not. See, at last, safety is very, very important factor for a surgery. Even it's a minimally invasive surgery, safety is very, very important. So please do consult a qualified person and get it done by them.
Okay, very interesting, doctor. So, doctor, now my favorite part. Can you give us some important tips for healthy hair?
There is no important tips more than maintaining a healthy lifestyle, like having a proper balanced diet, staying hydrated, sleeping for 7 to 10 hours. These are the main factor for your hair health. Other than the supplements and things we use a mild shampoo which is sulfate paraben free. Avoid heat staining or harsh chemical treatment. Use a white comb to combs because for to remove the tangles and everything for reduction of hair loss. And please consult your dermatologist to select the proper products for your hair if you are facing any problem. Treat the underlying condition when you have a dandruff or any hormonal imbalances or thyroid disorders or even nutritional deficiency, because these are the main factor for your hair loss. Please do consult a dermatologist and get it done.
Okay, that's very interesting, doctor. So, doctor, can I take some live audience questions?
Yeah, sure.
So, the first question is, doctor, 2 years back, I got a fire emergency, and because of that, I lost a part of hair in my scalp, and now the hairs are not growing back. Can I go for a hair transplant?
Yeah, scarring alopecia is one of the indication for hair transplant. But depending upon your depth, depending upon your donor area, if whether you have healthy hair in the back, it can be done. Please do consult a qualified dermatologist and get their advice depending on your need.
Another question from our audience is, Hi doctor, I'm also from Tamil Nadu. How to get your appointment? And I have androgenic alopecia, and my neighbor told me that in androgenic alopecia, the only thing you can do is hair transplant. Can you please tell me what is the fact?
No, androgenetic alopecia, hair transplant is one of the treatment. There are many other treatments. Medical treatment is the first line, depending upon your stage of androgenetic alopecia, depending upon your grade of losses. So please do consult us. You can Google our Skin Pro clinic, and there'll be number available. Please do call us and come and contact us.
Okay, doctor. I'll just take quickly the last question because we are running out of time. He's asking, Hi doctor, my daughter is 12 years old and she has a lot of white hairs, and we did a lot of thing at home to get rid of those white hair, but she's having a lot. How to help her, and why she have such a white hair in such young age?
See, it is called premature candidiasis. It is very, very common nowadays because of the lifestyle of the kids. So please do consult a dermatologist. There are treatments for white hairs, and it is better to consult and get it done early because before 18 years, the results of treatments are very, very good for the children with white hair. So do consult a dermatologist and get the treatment done.
So these kind of white hair in the young age, they can be controlled or reversed.
Yeah, it can be if before 18, it can be reversed completely if the treatment is done properly by a dermatologist. After 18, it can be controlled. Surely it can be controlled, but you need to take treatment for a longer period of time, about 6 months, but it can be surely controlled.
Okay, that's very interesting. Doctor, discussion was very informative. I'm sure our viewers have found the session very helpful. So, doctor, would you like to give any take-home message or any other suggestion to our viewers today?
Thank you so much for having me. It's a pleasure to be here. And for hair loss, it's a concern for everyone. So, if you have a more than 100 hair lost per day, please do consult a dermatologist because they will know what to do for your hair. So, start with medical treatment only for pattern hair loss or scarring alopecia. Go for hair transplant. Not everyone needs a hair transplant. Don't be in hurry to do hair transplant. Start with medical treatment. There will be very, very good results with medical treatment if you're maintaining. But even after doing hair transplant, you have to continue on minoxidil. So do not stop with hair transplant surgeon alone. Please do consult a qualified person and get it done by a qualified person and maintain a healthy lifestyle. There is no better way to keep your hair healthy than having a healthy lifestyle than anything else.
Very true, doctor. Thank you so much, doctor, for sharing all the expertise with us today and answering all the questions of our viewers today. I'm sure the viewers have found the session very helpful. And thank you, doctor. It was a delight to have you, and thank you so much for your valuable time.
Thank you, Mana. Thank you.
And also thank you to the viewers for joining us today and asking so many questions. And if our doctor have some more time, we can post some more facts behind skin and hair care. Until then, doctor, take care and have a nice day.
Thank you. Take care of yourself.